Hi, everybody. So today we're going to be talking about pediatric feeding, specifically into the suck, swallow, breathe versus the suck reflex. I'm Anne Marie Sajak.
And I'm Anna Apostolos.
So first, the suck, swallow, breathe, also known as the SSB.
So, the suck, swallow, breathe, also known as the SSB, is a rhythmical pattern that occurs and is necessary during nutritive sucking. This is the ability for the child to coordinate between both eating and breathing at the same time.
So some key terms: non-nutritive sucking, which is not consuming essential nutrients like the pacifier, or nutritive sucking, which provides essential nutrients like gaining milk. So for the suck, that's a movement that occurs when something touches the soft palate, resulting in the baby to start that sucking. The swallow, which is the bolus and oral cavity that triggers the swallow. So the soft palate lifts and the bolus moves down the esophagus. And the breathe, which occurs before and during the suck and swallow process to begin the swallowing process.
So, for every one suck, it should be followed by one swallow, which is then followed by one breath. And that pattern just continues. Children who are born prematurely do not necessarily have this skill yet, so pacifiers are used to help them develop this pattern of non-nutritive sucking.
So how to know if the suck, swallow, breathe is not rhythmical? So infants may make uncomfortable noises. So as parents or as healthcare providers, we can listen to them while they eat. And they also may make facial grimaces. So look at their facial cues for any signs of discomfort during that feeding.
And in this attachment, we're also going to include a video that shows an example of an uncoordinated SSB. So why is the SSB so important to feeding? The coordination of these three aspects helps to ensure that the infant is swallowing both safely and effectively. With a coordinated suck, swallow, breathe, aspiration and choking are less of a risk than an infant with an uncoordinated SSB. And suck, swallow, breathe is important to ensure that the infant is effectively feeding and receiving the proper nutrition.
So the suck reflex. So the suck reflex is an action that infants display when the object, like the bottle or nipple, comes in contact with the hard palate or the roof of the infant's mouth. So the contact between the object and the hard palate triggers the involuntary suck reflex.
Why is the suck reflex so important? It aids in feeding by enabling the infant to perform the sucking motion effectively. It contributes to effective feeding so the infant receives proper nutrition for growth and development.
The suck reflex goes away at around 4 months, turning this reflex into a voluntary or automatic behavior.
So, some differences between the suck, swallow, breathe and the suck reflex. The suck, swallow, breathe is a series of rhythmic movements that contribute to safe and effective feeding, including both the sucking, the swallowing, and the breathing. And the suck reflex is a singular movement that is the initiation of sucking.
So some similarities between the two is both the suck, swallow, breathe and the sucking reflex contribute to safe and effective feeding for the child. And also it helps to ensure adequate nutrition for growth and also development.